Each year, millions of people wind up with scars after surgery, trauma, and/or burns. Plastic surgeons can help, but our professional opinions on outcomes aren't the full story. It's important to know what you, the patients, think about the results. That's why the authors of this innovative new study in the Journal of Plastic and Reconstructive Surgery is so important. And of course, my guest today, Dr. Andrea Pusic, is an expert in outcomes. She has written some of the most outstanding and novel articles on outcome studies in plastic surgery. And she's developed this unique measure on plastic surgery and patient-reported outcomes for scars called PROM. So, Andrea, tell me about how you came about to do this type of study.
Okay, thanks, Rod. Thanks. So our research team has expertise in developing patient-reported outcome measures, or PROMs. And PROMs are questionnaires that are specially designed to help us understand, to measure some of the outcomes that matter most to patients, like quality of life, symptoms, and satisfaction. So based on work that our team had done previously, we had performed interviews in close to 500 patients who had plastic surgery procedures. And in those interviews, patients talked a lot about their scars, about how the scars had affected their quality of life, how they might feel differently or have different changes in function. So we knew we had a lot of great information about how patients perceive their scars. And so effectively, we used that information, those insights from these patients, to help us develop this new patient-reported outcome measure, or PROM, called the SCAR-Q.
And what people need to know is that Dr. Pusic is an expert in this, and you validated this PROM. And I think, what does that mean? Why is that so important for this study?
Yeah, so the initial paper that we published was on the interview component of talking to patients. In this validation study, what we're really looking at is how well this new measurement tool functions, and that's really what validation is. And I would add also that this was a big international study. We had help from over 700 patients in 4 countries.
That's totally amazing, and of course challenging to do. So what do patients need to know about this type of study and their outcomes?
Well, I think that what patients need to know are that PROMs, or patient-reported outcome measures, are increasingly important and being used in clinical care and in research to help doctors and researchers deliver better care and develop new treatments. I think we are at our hope that the SCAR-Q will be used around the world to develop new treatments to improve scar outcomes from the patient perspective. I would add also, Rod, just in the last year, we've seen over 60 research teams in 20 countries that are using the SCAR-Q to develop new options and performing new studies using the SCAR-Q. I think scars can be very visible, they can be distressing to patients, and the SCAR-Q is an important new tool that will allow us to develop better ways to treat scars and improve outcomes.
That's right, and it also helps us as plastic surgeons to treat our patients actually and to listen to what they think about our scars, because of course we all think our scars are great, but it's the patient that really matters. So thank you so much, Dr. Pusic, because what you've done for plastic surgery has been totally amazing. It's been revolutionary. And of course, and thanks for publishing it in the Journal of Plastic and Reconstructive Surgery, the #1 journal for all of plastic surgery for evidence-based and outcomes research.